Good afternoon to everyone present here. So we are from Group 1 of Group 5 for PBI1082, English for Occupational Purposes. And we would like to present on our topic today, which is language and cultural barriers leading to miscommunication in healthcare setting. Before we start with our presentation, I would like to introduce myself and my group mates here. My name is Antonia, and over here we have Suyani, Michelle, Nur Aisyah, Dayang Rahaiza, and also Nur Izdihar. So we can start with the introduction. I would like to pass it to Michelle.
Hello. So I'm Michelle, and I'm going to start with the introduction. So it is believed that language and cultural barriers has affected the quality of care and safety provided to the patients. Patient and interpreters, language barriers cause inferior patient assessment, delayed treatment, incomplete understanding of the patient condition, misdiagnosis, risk of medication errors, and complication and prescribed treatment. Now I would like to pass it on to my colleague.
Okay, so the first solution is using simple term and language. Effective communication through plain and clear language does give a significant impact, especially when communicating with the patient. Using medical jargon without noticing the patient wouldn't understand the meaning of the term may lead to confusion and misunderstanding. So a research led by Gillian Rowland of King's College London reported that 43% of the clients struggle to understand health information that contain text. Based on the research, patients who faced the most difficulties were older people, ethnic minority groups, those with low qualification, those without English as the first language, and low job status. For example, he reported that the patients who were referred for a chest x-ray have not done it as he failed to find the department as the sign showed radiology, and he was embarrassed to ask for help. So the implementation is, firstly, keep it plain and simple. All the information required to be delivered to the patient must be short and precise to add a straightforward interpretation. Rather than using vague words and medical jargon terms, use shorter and more common words to replace them so patient can understand easily. Second, keep the message short to the point. Sentences are full of conjunction and long words, making it difficult to retain their message, their meanings, and the patient may interpret it wrongly. If the sentences are wrongly understood and incomplete, it may lead to wrong decision making. Regularly, we often hear people use more abstract words than concrete words. For example, if a doctor administered a patient to take the medicine regularly, that could be wrongly understood. That could be understood as every day. The concrete words which is meant by every day, 3 times a week, or even just once a month. Hence, patient may interpret it wrongly unless the message is delivered in detailed word. For example, to give full details on the patient need to take medication 1 time daily. So mean 1 time a day. So could be that's how we make the patient easier, to understand. Thank you. So I'll pass the next solution to Ms. Rahaiza. Thank you.
Okay, thank you, Sarani. Hi, everyone. I am Naira Haiza. So we move on to the next solution, which is the using visual method of communication to solve this issue. So visual aids are referring to the graphical representation that helps to convey a message or inspire changes to the specialized audience, which is more convenient, rich content, and time efficient. So Garcia Ritamero and Coakley have conducted a study in 2013 that reveals well-designed visual aids are effective enough to promote awareness and improve comprehension associated with medical condition. So through the implementation of the visual method of communication in healthcare settings, any kind of information would be easier to digest as the contents are presented visually. And it is also undeniable that visual aids help to boost a patient confidence in making clinical decisions, and also improve their satisfaction in receiving care. Okay, when we go through the implementation of this solution, first of all, we need to conduct a meeting which gathers all the healthcare members to have a simple discussion, I think, and identify the relevant topics of health education. And then we may proceed with the media management team, which would be in action in designing the ABAs, which is audiovisual aid, based on the topic that have been chosen. So we could manifest a simple iconography and use relevant pictures and also choose a fresh color combination. And last but not least, all the staff are encouraged to use the ABAs such as brochure or maybe poster in practice. So that's all from me. And then I will pass to Miss Aisha for the next solution.
Hello, my name is Nur Aisha. I'm going to continue with third solution, which is cultural and lingual adaptability. Different cultures demand different services and care from providers. And without cultural adaptability, even the most experienced employee providing their care to the client with a different culture can create confusion or even be perceived as an act of misconduct. Operative communication between clients and care providers is a crucial process to deliver safe and satisfactory care. It is extremely important for them to learn how to adapt to culture and language differences, as they are the frontline staff who work to provide care for clients. As part of HR management, the member will conduct 3 domains that will be inclusively pursuing the orientation coaching, cultural adaptability, and language skills. For the first domain is the matter of what to expect when living and working in our setting. Excellent incorporation is the result we anticipate upon accomplishment while overcome difficulty to settle into their new country or state. Hence, they will be referred to complete their assignment training about intercultural sensitivity and complemented by comprehensive studies about cultural difference between home and host country or state. At the last step, we would like to consider better diversity and incorporation within this company to enhance language skills. Our newbie employees will undergo several classes on additional language such as Malay, Iban, Bidayo, and several other native language to access information once they step on our countries or states, as well as full courses being managed and scheduled. We will analyze all employees' background, which then shortlist the individual who needs to enroll for this pre-employee training. That's all from me.
Okay, I'm Nur Izdihar. So to conclude all the discussion we've done just now, it's clear that having limited knowledge about foreign language and culture makes things hard for both healthcare providers and consumers. It's not only like reduce the quality of communication and patient care, but it also may lead to potential medical errors and misdiagnosis. If these issues are getting out of hand without proper approaches and preventions, optimizing patients' care, quality of care, and satisfactory level of care provided would be a challenge for health professionals to deliver the suitable services and facilities that meet the patient's needs. Thus, there are several methods that have been suggested just now to overcome language and cultural barriers in healthcare settings. This includes using simpler terms and language, using visual methods communication, as well as adapting to the different cultural surrounding. Most of solutions suggested can be done as they are more cost effective and the resources are available in most healthcare institutions. Besides, every individual, including healthcare professional, is responsible for adapting and respecting other culture and language in order to maximize the quality of care and improve patient outcomes. So That's all for our group. Thank you.